This meeting is being recorded.
It still says waiting to start on my end.
Well, I see that it created its own ID. So can you please share it out there? I see that we are up. I hope that helps. Everyone will get started in just a minute.
It still says waiting to start on my end.
I see it live, Kelly. Somehow
Okay.
I clicked on it and it's live.
That it created its own ID. So can you please share it out there? I see that we are up. Okay, we will get that to you, Gabe. For everyone watching, we'll go ahead and get started. Happy lunchtime. I'm Kelly Casey, executive. In just a minute. I'm the executive director of Think Kids, and thank you for joining us for What You Know About the Handle with Care program. Over the next hour, we're going to speak with a few administrators of the program around the state, take your questions, and share information about how you can help support your community's kids who may be living in sometimes stressful places. Many thanks to Gabe and Lisa who have joined us today and will be letting us know if there are any questions or comments in the video below. So make sure and share them with us. I want to begin by introducing Andrea Darr, Director of the West Virginia Center for Children's Justice, as well as the state's Handle with Care program. And then she can introduce the coordinators who have joined us today. And I hope you all can tell us a little bit about where you're from and how you're connected with the Handle with Care program. So Andrea, we'll start with you.
Hello, thanks for having me today, Kelly. This is so exciting. My name is Andrea Darr. I'm the director of the West Virginia Center for Children's Justice at the West Virginia State Police. I have two small grants that look at the investigation, prosecution, and resolution of child abuse cases. We want to respond better. We want better outcomes for kids. And to that end, we created a program called Handle with Care, and we're here to talk to you about it today. With me is John Duffy, who is the lead counselor in Kanawha County for all the school counselors, and he's been with Handle with Care since day one. And we have Margie Lynch, and Margie is over in Berkeley County, and Margie is coordinating a program in Berkeley County that we're calling Handle with Care 2.0. It's sort of the all grown-up program of Handle with Care with new tools and resources. So I've invited both of them to share what they know about Handle with Care for us today. So John, you want to introduce yourself?
Sure. My name is John Duffy, and I serve as the Director of Counseling and Testing here for West Virginia's largest school district, Kanawha County Schools. So I support our school counselors. We have about 65 schools here in the district, and as Andrea mentioned, I've been serving as a coordinator for our Handle with Care program here in the district office for it'll be almost 9 years this summer. So look forward to, great to be here this morning.
Margie, can you tell us a little about you, please?
Yes, I'm Margie Lynch, and I came on as the site coordinator for Handle with Care 2.0 starting last year. Prior to that, I was a school counselor in the school system in Berkeley County for 8 years, and before that in Los Angeles, California, mostly working in the high schools. So thank you, John, for all your work and supporting school counselors. I'm sure they appreciate you very much. When I started this grant last year with Andrea, we've been implementing quarterly meetings this year, and it's been a wonderful experience. I had some familiarity with the Handle with Care program when I was a school counselor, but I've definitely learned a lot more through Andrea and through this work. So I'm happy to be here.
Glad you all three joined us today, and I'm excited to learn about 2.0. But before we get there, Andrea, let's start with the basics. What is the Handle with Care program? We all do.
Handle with Care is a program to help children succeed in school to the very best of their ability, regardless of what hard place that they're in. You know, in right now, between poverty and the drug crisis and the pandemic, it's really tough to be an at-risk kid. They're exposed to a lot of things that can interfere with their ability to learn, to form relationships, and to function appropriately in the classroom. So Handle with Care is a program aimed at those kids. How can we help support them better? How can they feel relevant at school and learn? So that's basically what the Handle with Care program is about. We want to help kids get through that day, that week, that month, and that year so they can stay in school and graduate, because that's the best thing we can do for them. So at its core, what Handle with Care does is it's a combination, it's a partnership between law enforcement, schools, and mental health providers. So I'll just give you an example. Let's say, how about this? Let's say it's 2 a.m. Law enforcement is called on the scene of an incident. They get there. There's one caregiver that has to go to the hospital. Maybe one caregiver is arrested. There's children present. So odds are, where are those kids the next day? They're in school and they're struggling and they're having a really hard time, and nobody knows what's wrong with them, right? They just think that children has bad behavior, or that child was stuck playing video games all night long. They have no idea. But what Handle with Care does is it alerts the school that this child has been on the scene of a first responder incident in the last 24 hours and might have academic, emotional, or behavioral problems. So what actually happens is the law enforcement at the scene, anytime children are present, get the name, age, and school of that child. So the name, age, and school is forwarded over from the law enforcement officer to the school before the start of the next school day. Schools are prepared. They're trauma informed. They have that trauma informed lens on. They've been educated about trauma, what it does to a developing brain, how it might manifest itself in the classroom, and what they can do to address that trauma in the classroom to make that child feel safe so they can learn. And it could be just simple things like food and sleep and a quiet place, retesting, postponing a test. It could be things like that. But some of these children really need to talk to a therapist. So at the school, if the child is struggling, they can go to the counselor and do some crisis counseling there. But at some point, some of these kids are going to have to be passed off to a therapist. So that's what Handle with Care is. It's those 3 parts. It's law enforcement sending the notice over to the school, and it's only 3 words, Handle with Care. No details are ever given. It's schools becoming trauma informed, and it's therapy on site at the schools. Parents can't get their kids to appointments for a lot of reasons. You know, they're working 2 or 3 jobs. Their transportation's an issue, especially in rural West Virginia, and sometimes it's not the priority. So we don't even want to go there. We want therapy on site at the schools and children to have access to it. So in a nutshell, that's what Handle with Care is.
Great, thank you. So, and I'll open this question to all 3 of you. It sounds like a pretty basic and important concept. What are the benefits of the program? I'm sure there are many.
I think one benefit is that we're able to identify students who are in need, students who may be in crisis, to respond and to provide those students with support and the resources that they need. And so I think early identification and that early alert, so that our teachers can be aware, so that our school staff can be aware, so that we can, again, wrap around that student the supports and resources that they need.
I would agree with John. I think as a former school counselor, if you're in a school of over 1,000 students, there may be some students that fall under the radar. They're good students, not any behavioral issues, that type of thing. So if that Handle with Care notification comes in, as John said, that alerts you to, there may be something going on, and you get that student on the radar, which is so important, because once they're on the radar, then you're able to monitor that student and make sure that that student gets the supports that they need, should they need them.
Another
Absolutely.
advantage. Kelly, is just welcoming the child to school. You know, I heard the state superintendent say one of the biggest obstacles we have is absenteeism. It's just getting that child to school. And if you're that child that has had a really rough time, that doesn't have a whole lot of resources, that doesn't feel very good about themselves or where they are, you know, it would be tough to walk into that 7th and 8th and 9th grade every day, you know. And so part of this is just making sure that that child feels welcome at school, that we want them, you know, when they walk through the door, they need to feel safe, they need to feel loved, they need to feel cared for, their basic needs need to be met, and they need to know that we want them there and we want them to succeed.
Great point, Andrea. Thanks. Lisa and Gabe, are there any questions or comments online?
There are no
Nope.
questions.
Great, thank you both. So I'm going to dive into the history of Handle with Care, because I find one of the things I talk about often as a kids health advocate is there are some things in West Virginia we do really well. And I'm so proud that Handle with Care is a homegrown, you know, started here in West Virginia. Now it's all over the place. So Andrea, since you were there and helped with the inception, can you give us a bit of a history on Handle with Care?
Well, I sure could, and it does have a history for sure. And I'll give you the blow by blow, but you're right, it absolutely did start here in West Virginia. But let me back up just a couple of years before we started it. In 2009, there was a big survey, national survey, that found that 60% of children had been exposed to crime, violence, and abuse in their home, schools, and communities, and 40% had been direct victims of 2 or more violent acts. That was a wake-up call. It's letting everyone know we have this population of kids that is exposed to all kinds of traumatic situations. What can we do to help them? What can we do to help them stay in school? So in 2010, Attorney General Eric Holder launched the Defending Childhood Initiative. I don't know if the people watching remember that, but it was a Department of Justice initiative calling all states to come up with some programming to address this issue. And there were some grants that were given out to this, but we didn't get the grant, but we met monthly in 2011 around the table. We got everyone there, first responders, law enforcement, mental health providers, school staff, attendance directors, counselors. We got everybody who had anything to do with children to the table. And we looked at programs all over the country, other Defending Childhood initiatives that had been successful, that had been funded and successful. And we zeroed in on this one program that came out of Brockton, Massachusetts. And the way we got there is very interesting. Mr. Leon White in Huntington, West Virginia was at these meetings, and he kept saying, I saw this program at a Weed and Seed conference in Florida, and I think it will help our kids. So he just, that squeaky wheel that kept going. We started looking into this program. It was called a Red Envelope Project out of Brockton, Massachusetts, with Ed Jacobs and Ted Cruz leading that initiative. And we really liked what it did. That program was just on domestic violence. It was very specific. We wanted our program to address all kinds of trauma, not just one specific kind of trauma. And then we looked at other programs, and we just kind of put our program together. And then Felicia named it Handle with Care, because she said that makes more sense than a red envelope. And so that's how we got started. So in 2011 and 12 is when we kind of put all those pieces together. And we had to then run it by all the bosses, all the attorneys, all the agency heads. They told us what we could and couldn't do. You can't do this because it violates confidentiality. You can't do this because it might jeopardize victim safety. You can't do this because it violates my policy. It might not violate yours, but it violates mine. So we have to make sure it doesn't violate anyone's policy. You can't do this because I said you can't do this, right? So everyone put in their 2 cents, and they chopped it all up, and they left us with 3 words, Handle with Care, which turned out to be a blessing. That's all we got. That's all we could give, is Handle with Care. So it worked in our head, but we wanted to pilot it to see if it'll work in a school. So 2013, we picked Mary C. Snow Elementary in Charleston because that was the busiest law enforcement car in Charleston. So we thought there'll be a lot of calls there. If we're going to see if this program has benefits, it'll be where there are a lot of, first responder incidents in that neighborhood. So we piloted it at Mary C. Snow and recognized very quickly it was smart. It didn't take money. It didn't take a lot of work. It addressed a population of kids that desperately needed some attention and supports. And so from there, it just kind of took off. This program is law enforcement led. And so in 2015, the colonel at the state police said, come on over and we'll help, launch it statewide in all 55 counties in West Virginia. So in 2015, between 2015 and 2017, we went to all 55 counties at least one time, and some counties 3 and 4 times, trying to get the concept understood. This program is so simple, it sometimes goes over people's head. They try to make it a little more complicated than it is, and that doesn't help anything. It's literally on the face of it, this simple. The notice goes to the school's providing trauma-sensitive interventions and therapy on site at the schools. So let's see, here we are in 2012. After between 2017 and now, it's just taken off nationally. I mean, my emails are just filled up with people all over the country wanting to know about Handle with Care and wanting to do it. We share our program with everybody, but we ask that they follow the model of fidelity. Everything we do for a reason. If you want to be a Handle with Care, do it the way it's laid out. There's a lot of thought and methodology behind everything that we do. So we ask everyone to follow that. But it's all over the country. I just got back from the National Governors Association speaking to all the spouses about it. But like I said, it's just calls and emails nonstop from all over the country. I even got an email from a law enforcement officer on an island off the coast of Australia asking if he could do Handle with Care. So that's the history.
I think I heard 40 states at one time that there was at least talk of implementing the program.
There are. Like Maryland does it statewide. Oklahoma has a notification system statewide. Michigan, over 3/4 of their counties have Handle with Care. So it's like in different pockets. Some places it's state led, and some places there's little pockets, and we try to hook up all the little pockets together so they can learn from each other.
Well, that's a great transition, talking about hooking up those little pockets, because in West Virginia, we know that it's done differently in each county. So I'm really looking to the expertise of John and Margie to explain to us how it happens in their neck of the woods. So let's begin, let's go alphabetically. So we'll begin with John. How is it implemented in Kanawha County?
So in Kanawha County, is much like the model that Andrea mentioned earlier. It begins with law enforcement responding to the scene and a child being present. So here in Kanawha County, we work closely on the Handle with Care program with 2 of our largest law enforcement agencies. So Charleston Police Department, Kanawha County Sheriff's Office are 2 of our largest Handle with Care partners, although South Charleston Police and a couple of other smaller municipalities are also involved. But so once the agency identifies a student and obtains their name and their age and what school they attend, here in the district office, we actually provide to our local agencies the contact information for every principal and school counselor in our district. So every high school, middle school, and elementary principal and counselor, our Handle with Care partners have that contact information. So they can send that notice straight to the school. As Andrea mentioned, that often arrives before school even starts. So then the principal and or the school counselor will then notify the child's teacher, so that the teacher can then monitor the student, observe, check in to see how they're doing, and then make appropriate referral to one of our student support staff from there, whether that referral could be the school counselor, could be the school nurse, might be the school psychologist, so that we can provide that trauma-informed care and support. And so we also report our, at the end of each month, we also report the number of notices that we receive each month. Our law enforcement officers also copy my office on the notices that they send to each of our schools. And so that allows me to do a quick follow-up email confirmation with the superintendent copied in, just to be sure that that school is able to proceed and reach out to inform those teachers in a timely fashion. And that's, again, I think this past year, you know, we're working we work very closely with a number of our community behavioral health agencies. And so we have a memorandum of understanding in place with 8 or 10 local mental health agencies who are able to come into the schools and provide school-based services. As was mentioned earlier, sometimes these students don't have transportation or the finances for community-based mental health. And so the agreements and the arrangements, the partnerships that we have with our mental health agencies are really, really important when it comes to the collaboration with Handle with Care.
That's great. Thanks, John. I have a question, just an estimate. In any given month, how many Handle with Care notices do you get?
I would say an estimate would probably be anywhere from 30 to 45 notices in a month. Yeah,
Great.
probably yeah, I would say, yeah, we probably average close to 40 to 45. I think that's off the top of my head. Yeah, good estimate.
Great, that's helpful. So it's, you know, Kanawha is the largest county in our state. So it's you know, the kind of TLC that you're talking about, having to do the follow through, some care coordination, it's doable. You have the staff that can, you know, do, for example, you have to get parental consent to provide mental health care. So that takes a lot of time and coordination. And so it sounds like you have a really good team of people who are willing to work together to ensure the kids get what they need.
Yeah, absolutely. Absolutely. I think that student support team and communication within each school, we're fortunate here in Kanawha County that we do have, even in each of our 43 elementary schools, we have one school counselor devoted just to that school. A lot of districts and states around the country, we have school counselors that are responsible for more than one school. And I think that's really, really important here in Kanawha County, that we've, because our school counselors, our nurses, our social workers are able to collaborate, work together, and again, address the needs of these students who have been exposed to some very adverse, traumatic situations.
Right, that's great. And with legislature in session, it's important to say we really do need more nurses and counselors in our school.
Absolutely.
What a big change, game changer that could be. Margie, we will pivot to you. Is it different in your county?
A little different. And speaking of school counselors in Berkeley County, which has about 31 schools, they just hired 20 more school counselors for this year. Thank goodness, because like John said, it's a huge need in the schools, especially after the pandemic and what these students have been experiencing. I know this year alone, from talking to people in the school system, it's just been a very challenging year. So to have that additional staff being there to support students is critical. So the Handle with Care program in Berkeley County, the Handle with Care coordinator is Patrick Patton. And I work under Handle with Care 2.0, so him and I work very closely together. And the system is somewhat similar. We have a notification link that is given to all the first responders. So with Handle with Care 2.0, we have added in EMS and the local fire department. And so law enforcement and the two of those share the same link. So if they are on a call and there's a child there, all they have to do is tap on that link and put in the information, the student information, And that goes directly to Patrick Patton, who works at the district level, and another assistant superintendent. And then from there, Patrick has all of the contacts at each of the schools where the handle with care notifications are sent to. And most of the schools, there's at least one admin, a school counselor, and a social worker if they have a social worker at that school. So Patrick will get that information to the school right when he receives it himself. So most of the time they are able to get that information right in the morning. So the principal and the contacts for handle with care notifications, they notify the appropriate people, the teachers, and just to let them know. And again, what Andrea said, no details, but just, hey, there's something that happened at this student's house last night. So just be aware. So it works really pretty similar to that. And again, we're trying to get EMS and fire more on board. So we're going to be offering some handle with care training about the process to kind of educate them more about how critical this process is.
That's great. And with your last sentence, that's a good transition to the next question. So, you know, it takes a lot of people and a lot of planning, and every county is different. What are some of the challenges to implementing the program that you've experienced?
I think, you know, for me, and again, I've just been with the Handle with Care 2.0, but I think, you know, the buy-in. I think sometimes that what Andrea mentioned is people tend to complicate the system when it's a very simple process. So I think to get the buy-in, it's very important that they understand what the process is and to simplify it as much as you can. You know, just straight out, you know, this is what it is. There's no more to it. The ultimate goal is to support these students. So I would say that's probably one of the bigger challenges, but once you're able to educate them and they get a process in place and you can help them with that, then they're all in.
Margie, could you talk a little bit about, sorry to interrupt, but Margie's doing some great work with first responders on your quarterly meetings. Could you share a little bit about that information? Because that really does address that barrier.
You know, it does. We started having quarterly meetings last fall, and we have in attendance all the first responders. So we have the, you know, chief of police, we have the state police, we have the county, the sheriff, we have the fire chief, we have the director of EMS, we have mental health organizations, one of them that supplies school-based therapy to all the schools in the county. We have teen court, we have Boys and Girls Club, the Martinsburg Initiative. So we have, you know, sort of a collective group of people that all have the same goal in mind, which is to help kids. And we meet on a quarterly basis. And there we talk over the Handle with Care notifications. We also do that monthly as well to keep everybody apprised of what's going on a monthly basis. But we're able to actually do a snapshot of all the schools in the county and how many notifications have been sent within the county. Last meeting we had, there was actually an area within the county where the notifications had increased significantly. And there's, you know, a real kind of drug problem that's in that area. So one of our organizations, the Martinsburg Initiative, is now doing some drug programs over there for the students, Too Good for Drugs program. And that was based just on that snapshot and a discussion by the group over, okay, what's going on? Let's see the big picture. So things like that where people can really cross collaborate and really understand information relevant to each of the organizations, I think has been extremely helpful in moving this program forward.
John, do you have anything to add?
I would just share, you know, the challenge that Marjorie mentioned, I think is really important. And that's, you know, in regards to buy-in. I know Andrea and I have met with several of our smaller municipalities who we've attempted, you know, being in Kanawha County, we're obviously a very large county covering a large geographic area. So I think opportunity, again, our larger law enforcement agencies are on board and very active, but a handful of those smaller municipalities, agencies, we'd like to bring on board. And I love how Margie has engaged the fire and first responders. That's great. One thing that I think what's made it so, I think one thing that's been, I guess, contributed to success with a couple of our larger agencies, and that is an internal champion that with Kanawha County Sheriffs, with Charleston PD, there's a detective that's kind of grabbed the bull by the horns and has been really provided some great leadership within the agency to continually improve the process and to be sure that the notices are being sent and followed up on. And so that's been one, Detective Spalding with Charleston Police and Detective Anna Powell with Kanawha County Sheriffs. They've just been instrumental in the success of Handle with Care here within Kanawha County Schools.
Great, thanks. Andrea, do you have anything to add? I know that you and I talk pretty often about, a county will have a really great program, but then someone will retire or there'll be changeover, and then suddenly, they'll stop getting those notifications. And so
absolutely. Well, I know the second county we went to was Cabell County in Huntington, and we were getting notices routinely, and all of a sudden it just stopped. 2 or 3 months we got nothing. And I looked into it, and the officer that was charged with Handle with Care had been laid off because of funding issues. And it just didn't get picked up by someone else. So as John said, when you have these champions that really make sure it happens, if something happens to them, you really got to make sure you got another champion in there, or it's in place long enough to where it will continually go. But it can happen at law enforcement agencies, it can happen at schools. Anytime there's some changes, sometimes Handle with Care gets bumped around. But you just have to keep going back. I call them reboots. We just keep going back, reminding everybody of how important it is, how easy it is. And let's get it done. And they usually get on board. It just takes a while. It's constant reminding. I'm not going to say nagging, just reminding.
Well, we had talked earlier about finding, we talk about, getting it right. So a lot of people who don't kind of work in the sphere of advocating for kids or working directly with children don't understand the real benefits of the program. And so therefore it doesn't become a priority. They've got a lot on their plates. And so I completely agree. I mean, that's one of the reasons that we wanted to do this. The streaming event today was to get it out there that this is a really great program, homegrown West Virginia, but it takes a real collaborative effort on the community level. So if a community wants to either reboot their program or get one started in their county, what do you all think would be a good first step for them to do that?
Just call us. Call here at the Center for Children's Justice. And we've been rebooting by Zoom quite a bit. I have been out there a little bit. I think we're all going to start getting out there a little bit more, but it's just a matter of, start the conversation in your community. That's the first thing you do. Go to your superintendent, go to your John Duffys and your Margie Lynches, find your law enforcement officers, take them a cup of coffee and say how important this is. And once it gets on their agenda, have a stakeholder meeting, similar to what Margie's saying about her quarterly meetings up there. Get everybody in the room and let them know, these are the notices came in. This agency sent this many notices. This agency sent this many notices. These are the schools that get most of these notices. What can we do to make sure this always happens on a routine basis? So you just get everybody together. You make sure that the way you send the notice is easy, because if it's not easy, it's not going to happen. And I'll say it again, if it's not easy, it's not going to happen. Make sure it's very easy on law enforcement and first responders to send that notice over. Some agencies do a notice, an actual written notice, like in Kanawha County, they actually fill out the little notice that's on our website, handlewithcarewv.org. Some small counties, everybody knows everybody, so they just text. Apparently, text is what people pay attention to the most. I was told that first thing in the morning, it is tough. at school to get everything started. So a lot of times principals don't check those emails first thing in the morning because they're busy getting school started, but they do check those texts. So sometimes it's text, sometimes it's email. About a third of our counties have the notice at dispatch, 911, non-emergency dispatch. So law enforcement, first responders can just call up 911 and say, Little Johnny Center, City Elementary, handle with care, and they can get that notice over. We had a very interesting way of sending a notice start in Mercer County. Officer Truckenmiller and the mental health provider down there came up with a QR code, put it on the back of the Miranda card. You take a picture of the QR code, it opens up a joint email that goes to the schools. So, whatever works for you all in every county, you just got to figure out what your strengths are and send it that way. But again, if it's not simple, it's not going to happen. And the person in charge, if they don't have passion about this program, it's probably not going to happen because you can't teach passion. Right? You got to get it. You got to understand it to make it happen.
So if you're a person in a county and you think, I'm not sure we do this, or I want to see this get started, who would you consider the point person? Would it be the superintendent of schools, or, where would you start?
Go to our website, handlewithcarewv.org, click on the Handle with Care tab, go down to the county contact map in West Virginia, click on your county, and up will pop a name, title, phone number, and email. So if you go to Kanawha County, there's John Duffy. If you go to Berkeley County, there's Pat Patton. It's all right there. So you can call here or you can call your local county.
Wonderful. And we'll put a link to that in the chat below afterwards. Anything to add, Margie or John?
I would add that as far as reinforcing the importance of this program, one of the things that we're starting to do is invite the schools to these quarterly meetings. We have 6 pilot schools through this grant right now, and they're going to share information on how they're supporting these kids. Certainly not confidential information, but allowing the first responders and other organizations to see what the schools are doing because of that Handle with Care notification, I think is very impactful. And so, that's going to become sort of a common thing that we do at these meetings. Because they want to know. And I think knowing that information really reinforces the importance of sending those notifications.
Yeah. And I would just, add to that. I know we've had Andrea come in to speak to our principals for professional development from time to time. Chad Napper, the Handle with Care guru for the start of the program here in Charleston. And so I think that's also been helpful as we've prioritized being trauma-informed schools within our professional development in recent years here in Kanawha County, and really the role and the resource that the program is, that Handle with Care is, and in regards to being a trauma-informed school. And so I think, as Margie mentioned, they're really, really important to keep our leaders in the district informed and aware of what's going the process and the program and how it's benefiting our schools.
Great. Thank you all. I want to pivot over to Gabe and Lisa. Are there any questions or comments?
No questions so far.
Okay, great, thanks. I do want to ask, Margie had mentioned it a bit about the changes that we've seen due to the pandemic. And we've seen that certainly on a national level, the fewer kids are accessing healthcare at a time when there's a higher prevalence of kids experiencing mental health episodes or diagnosis. And we also know that the isolation, perhaps losing a family member, there's such need right now. How has that affected your programs?
Go ahead, John.
I think it just reiterates the importance right now that we have, we have more students and more families in crisis in regards to the pandemic, not only mental health related, but, financially. I know when the pandemic first hit in the early stages and many of our schools around the state went remote, we were worried about the number of children who would be hungry as a result of not coming to school. And so I think that, we've certainly seen, here in West Virginia and really nationally, the incidence of stress and anxiety and hopelessness among children and teenagers has been, has been exacerbated. And so I think that, I think that makes Handle with Care more important now than really ever, because it allows us again to connect and reach out to those students who need us the most. So it's been really important for us to continue that collaboration, to work closely with local law enforcement, with our community-based mental health agencies. Our primary goals as a trauma-informed school is, and I know that in a couple of the Handle with Care conferences in the past, some of Jim Sporlitter's work out in the state of Washington, where he did a lot of work with children who've been, exposed to trauma and adverse experiences. And what the research shows is that one of the best things we can do for a child who's been exposed to trauma is to connect them with one caring adult. And so, so really our 2 or 3 primary goals when we identify a student through Handle with Care is, we want them to know that school's a safe place, that home may not be safe, but school can be a safe place, that you've got an adult here or several that really care about you, genuinely care about you, whether that's the principal, whether that's a school counselor, whether that's the cook. You've got someone in this building that really cares about you. So we want them to know that they have one caring adult. We want them to know that school's a safe place. And thirdly, we want to provide that mental health, social, emotional support, whether that's from counseling from the school counselor or whether they need something a little bit more longer lasting by connecting them with a local therapist during the school day or within one of our local clinics.
And piggybacking off of John, I work part-time through a clinical practice and work with a lot of adolescents, sharp increase in depression, anxiety, social anxiety due to the amount of isolation during the pandemic, really wreaked havoc on a lot of students. And so and I believe a lot of the healthcare organizations, the mental health organizations, even private practices are inundated with clients that they're trying to help and trying to help them get over sort of this pandemic and moving on to some normalcy within the schools. A lot of kids aren't used to that structure that they didn't have for close to 18 months. So that's really been challenging within the schools. But like John said, I think, they need that normalcy. They need that structure that a school can provide and that support, whether it's the librarian, a teacher, a assistant principal, whatever the case may be. So I think this Handle with Care program is even more important now. And I think with having the quarterly meetings, trying to add participants in that work with kids, because honestly, it takes a village. And after a pandemic such as this, we need those community organizations to come and support the students, the kids. It's crucial. It really is right now.
Yeah.
Andrea, anything to add?
Well, I just want to say that a lot of the systems that are in place to help kids work because there are eyes on kids, right? They're interfacing at school, they're interfacing wherever people have eyes on kids and can visually see sometimes if a kid needs some help. So the pandemic kind of shut all that down, and there were a lot of kids stuck in some really hard places. Handle with Care really mobilized during the pandemic. There were Handle with Care coordinators in different parts of the state doing porch visits with kids, and just going by to say, I miss you. I wish we were all in school. Is there anything that you need? Food insecurity and housing instability really stuck out during the pandemic for these kids. There were lots of basic survival fears for these kids. So Handle with Care was in place to help identify where they might need some help. And social workers and PRO officers and teachers and lunch ladies and cooks, they could kind of reach out and keep an eye on the kids that were on their radar. So yes, it did help. Pandemic was it still is really hard on the kids. Shout out to all the teachers and staff for hanging in there and doing their job. We really, really appreciate you. And first thing this morning, the radio woke me up and it was a story on, half the teachers are thinking about retiring because this has just been so hard on them. So I just want a big shout out to all the teachers and staff and counselors.
I was talking with an attendance director about a month ago, and I asked her how it's been since COVID started. And she said, well, since COVID started, I've been to 600 houses, mostly delivering food. And so the schools have really adapted, right? Because they're out of necessity mostly to ensure the kids get what they need. And I think that's wonderful, but we still have some communities and counties that have not kind of collectively learned to adapt. So do you have any recommendations on how community members could get more active in supporting these kids?
The more people hear about Handle with Care, the more they want to get involved. I have found that a lot of people don't know about it or don't understand how it all works. But once they start hearing about it, they're like, how can I get involved? What can I do to help these kids? I saw something on Facebook about a program that was making beds for kids that didn't have beds. You know what I mean? And we pushed that out on social media just for counties to understand what are those resources out there? How can they be? The problem is the resource and connecting it to the family, right? There are the resources. A lot of times the families don't know about it, but just getting the word out about what we're trying to do for that whole child really invites a lot of community members in to help.
And I would like to add, the quarterly meetings can be used for that too. When you have 15 plus people at a meeting, they know lots of people who then know lots of people. So, just saying, hey, whoever, is interested in being a part of this program and wants to help kids, please, invite them to the next meeting, because the goal is to grow that community. Yeah.
And I think we became involved, Kelly, in Kanawha County. Well, obviously through Andrea's early work on the west side, and she talked about that earlier. But I think one thing that was really important that sustained our work, and that's the annual conference, where our student support personnel and our teachers and school counselors can come and hear about national best practices from experts from around the country about responding, supporting children who've been exposed to trauma. So I think also, the work that Andrea has done with the annual Handle with Care conference has been fabulous. And to be able to have the expertise here in West Virginia and to learn about research and some of those best practices has been really, really vital and valuable for us as a district, as well as on our front lines in our schools.
I agree. It's always one of my favorite conferences of the year. So Andrea, can you tell us a little bit about what's in store for this year's conference?
Sure. Our conference this year hopefully will be in person October 12th through the 14th at the Civic Center in Charleston, West Virginia. Really have our fingers crossed that we're really going to be able to do it in person. This conference we have been doing long before Handle with Care. It's a multidisciplinary conference, and it's all aspects of child well-being and child maltreatment. And there traditionally have been tracks for social workers, law enforcement, courts, medical for the non-medical people. We had a drug track for a long time because we had so many drug issues. We needed to understand the drugs trending and the resources in our community for for families that need those resources. But when we developed Handle with Care, we just added a Handle with Care track. So this conference has 3 plenaries and 42 breakout sessions. So at any one time, you can pick from 6 classes to go to. And our Handle with Care track takes you the overview: what is trauma, Handle with Care for law enforcement, Handle with Care for schools, Handle with Care for mental health providers, and then something a little different, maybe how to start Handle with Care in your community. One year we had yoga for Handle with Care, but just different aspects of things that can help. We generally had, the last time we had an in-person conference, we had 600 people from 18 different states. So we purposely created that Handle with Care track so people that want more information can come here to learn. In Florida, they sent a whole team years ago, and now they have a very strong program in Florida. But it's a great way for people to come learn about Handle with Care and all the different aspects of it, as well as other child maltreatment issues. The cost we have tried to keep at $150 every year. We've never raised it. So we'll just keep on trying to do that as long as we can do that. And we do have continuing education credits offered for all different disciplines. So yeah, we hope everyone can come this year. John has sent a group of counselors and staff from Kanawha County for years, a whole group of them. But we're very excited about our conference. We're going to have great speakers and hope everyone can come. You can find out more information on our website, handlewithcarewv.org. We don't have registration posted yet, but in the coming months, it'll be up there on the right-hand corner of the website.
Great, thanks. I'm remembering a couple of years ago, the last in-person, and I always try and think of, go through all of the sessions and to see who go and see, but then there's always, like, by day 2, somebody goes, did you go see so-and-so? And then you see that their room is packed, and then you want to go see that person. So it's a fantastic conference. I highly recommend that if anyone's watching, that they bookmark the dates. Did you say the dates? It's October
12th to the 14th. It's always the Wednesday, Thursday, and Friday in the middle of October, the weekend before Bridge Day. That's how we plan it, just so you know.
Well, thanks. So everybody bookmark those dates. And before we say some closing statements, Andrea, we had talked about the pandemic and that we have fewer mandated reporters with Eyes on Kids. Can you tell us a little bit about your mandated reporter training that is online?
We are so thrilled. We've been working on this for several years. We now have a mandatory reporter training on our website, handlewithcarewv.org. And it's when you click on it, you can actually go in there and just look around. If you don't need to take that course, you can look at different parts. Or if your agency has mandated reporters and they need training for their employees, it's free. You can go on there and take it. It has a script, it has videos, it has questions. If you can, at the end of the course, if you can pass 90% of the questions, then you'll get a certificate of completion and attendance. You can take it back to your boss and say, I have been trained in mandatory reporter to be a mandatory reporter. But it's going to cover what to look for. It will cover how to report, what you should expect when you call in to report that. It covers what the law is. It's really, really a good course, and it's not boring. Is what I'm trying to say. We worked hard to make it not boring. And along with reporting, we also have resource videos. Right now, there are about 11 on there. There are agencies around the state that can offer assistance for children and families. So you're going to learn they're little 2 and 3 minute snippet little commercials, who they are, what they do, and how to access their services. So check all those out when you're on our website.
I find those videos very important, especially if you're somebody who is in a community and you want to engage to help kids and you're not sure how. You get to find out of all of these different resources around the state and then figure out, what best fits for you, and then contact them and, become, jump in the boat and start rowing with the rest of us. So with that, I want to give everyone an opportunity. Are there any issues or ideas about the Handle with Care program that we may have missed, or you would like to make sure folks know about before we end?
I want just to add, Margie is working on a little pilot program, and she's referenced it, Handle with Care 2.0. But what that is we've been partnering with SRI Education, a national nonprofit that connects data with implementation. And they have created a Handle with Care implementation tool and monitoring tool for Handle with Care that will be on our website shortly. But every school across the country can use this to make sure you implement Handle with Care properly. And it will help you track all the data. How many notices expecting, how many kids, how many went to counseling, how many of those went to therapy. It measures the general population of kids against the Handle with Care kids. It'll show you in cycles and in the long run what's happening, so you can start seeing the trends that are occurring in your area. Again, all these are free, and you'll be able to input data in there on attendance, disruptions in the classroom, and achievement. So stay tuned for that. That's coming. I just wanted to add that.
And I just wanted to mention briefly, Kelly, that one other primary reason that Handle with Care is successful here in Kanawha County Schools has to do with Andrea's passion and leadership. So I just wanted to thank her for all of her support and guidance with the program here in Kanawha County.
She's the best. She is.
And I would like to second that. I've had the pleasure of working with Andrea for the past year or so, working under this grant. I've learned so much and love this program even more than I used to. And it's just knowing that we're doing the right thing for kids. It's a great program. I'm so glad to be a part of it and work with people like Andrea. So.
Oh, y'all are great. And y'all are so good to text me back at all hours of the day and night for all kinds of different reasons. So let's keep on texting and help those kids.
Well, thank you all so much. We'll turn to Lisa and Gabe one more time. Any questions or comments for us?
We're all good to go. No questions.
Okay. Well, with that, we will wrap up for the day. Many thanks to Andrea and John and Marjorie, and for everyone who joined us today. If you couldn't join us today, there's good news. This is all recorded, and we'll push it out on our social media sites as well as our YouTube channel. And we'll have links to the mandated mandatory training, the annual conference, and importantly, all of those contacts, county coordinators that you can connect with if you're wanting to help the program. If you have any additional questions or comments, you can continue to write them on this video below, or you can contact the Handle with Care program. You can contact Andrea, or you can contact the kids, and we'll make sure you get connected. So keep an eye on this space over the next few days. Thanks again for everyone who joined us, and have a great day.
Thank you.
Thank you.